Hi everyone, my name is Manik Madaan. In this video, we'll be talking about on how to prepare for the USMLE Step 2 CK. I myself scored a 271 on the Step 2 CK, so I think that kind of gives me the authority to speak on this topic, and I think I can guide you on that. So the first lesson you need to understand and take from this video is that Step 1 is highly important for you to score a really great score on the Step 2 CK. Even though Step 1 is pass-fail, the knowledge that you gain from Step 1, the concepts that you gain from Step 1 will come in handy in all of the other USMLE exams. Like for example, Step 2 and Step 3, it's like a ladder model, I would say. Step 1 is like the first step in the whole process, and then you kind of can jump to Step 2 and then Step 3. If you don't have a good Step 1 knowledge, making that jump from like 0 to the second step is kind of very hard, and you will find the transition extremely like uncomfortable, I would say. So please try to focus a lot on Step 1 and do not treat it as pass fail. I know it is pass fail, and because of that, a lot of people will be just let's get done with this exam. It doesn't even matter, it's just pass that I need. Please don't do that stuff. Prepare for Step 1 as if it was already it was scored, right? I would say 100% prepare for it as if it was scored. Do not ignore Step 1 prep, and make sure you have good foundation from Step 1 so that you can apply that to Step 2 and Step 3. Another rule of thumb I would say is Step 2 and Step 3 are actually, another rule of thumb I would say is Step 2 actually is about 60% of Step 1. So all that happens in Step 2 is one step ahead of whatever knowledge you have on Step 1. And if you don't have that knowledge of Step 1, it is very hard to just make certain assumptions or to come to a certain conclusion that is required as of Step 2, right? For example, if you want to treat a patient, they would ask you what is the next best step, right? But to know that next best step, you should know the pathology of the disease as well as the treatment, what is the most basic treatment, so that you can understand the next best step. So that is what Step 2 is, just an added layer of complexity to Step 1. And Step 3 kind of is the same thing. It is an added layer of complexity to Step 1 and Step 2, if that makes any sense. So now that you understood the ladder model and you now understand how important Step 1 is for Step 2, let's kind of jump into basic Step 1 prep on how to start orienting yourself to the main exam. So the first thing I've regarding that I would say is you need to first of all scope the whole subject matter of Step 2, because it is a very complex and it's a very big exam with a lot of syllabus. So for that, I would recommend using something called as Anki. So what is Anki is spaced repetition software, but the way I used Anki was just for scoping out the whole subject, for going throughout the every single topic in the whole exam, just in a week, so that I kind of knew what was important, what was not, and knew the syllabus of the exam, okay, these topics are what are going to show up, and okay, this is what is important. So the deck I would actually recommend is a pre-made deck. It's called the Tzanki deck. You can go with you can go to med school Anki and search for Tzanki deck, and you'll find it there. It is a combination of UWorld and Amboss, and it's very comprehensive yet concise for Step 2. And just download it on your Anki app. You can do it on your phone or your laptop. And after you do that, you can just press on browse mode. There is this thing called browse mode on the computer, so you can actually Google it or YouTube it on how to use Anki decks with the browse mode, and you can just go throughout the whole cards and the whole syllabus. It took me a week to finish the Tzanki deck. It's about 7,000 cards. So I went through 1,000 cards a day because I had the time and that so it was incredibly helpful for me to kind of have a bigger picture, or an eagle's eye view of what is and what is not important. And I think it would be incredibly helpful. The other deck I would say is nice is the Anking deck. But the problem with Anking deck is it is very big. It's 22,000 cards, so 3 times as bigger as Tzanki, and it is very updated, I would say. But if you should only consider Anking if you have the time to go through Anking. Otherwise, I think Tzanki totally works. I got a 271 with Tzanki, so it is pretty much, there's everything you need to know in Tzanki. But Anking is just very vast. I would say it's a good deck. Yeah. Secondly, after you've scoped out the subject, you know what is in there, I would say start like UWorld. Okay. UWorld here should be used as a learning resource rather than an assessment tool. But that being said, you should not ignore the assessment part of it. A lot of people have this black and white thinking, I think, where they are like, okay, just use UWorld as a learning tool and not as an assessment tool. I think that kind of thinking is wrong, because again, it's black and white. I would rather want you to think spectrally. So yes, you have to use UWorld as a learning tool, that's good, but 10% like, you know, of your effort should be trying to increase the percentage of whatever you're scoring. It doesn't matter where, like what percentage you're scoring, like 50, 60, 70. What matters is that improving. Because if you want to think about even football, for example, in football, there are like multiple, like, you know, levels of football. So the first is just like, you know, normal casual football, and then there's professional football. If you want to play in the like, if you just want to play like something casually, it is okay to not measure anything, and it's okay to like kind of just, you know, go along with whatever is happening. That is completely fine. But if you know, play like Ronaldo, right, like in the pros, you have to kind of see like whether you're improving or not. You have to see what works or not. You also have to like see if like whatever testing skills you have, like, you know, eliminating certain option choices, how good they are, and how like are you calibrating them per question, I would say. So I like, be hard on yourself for the effort, not the outcome. But that being said, again, 90% of your effort should be just learning and going through UWorld, and 10% should be sometimes looking at, you know, your percentages and not feeling bad if you score like bad in your percentages or you're not improving, but just like looking at it and at least like trying your best to improve it. And don't be unhappy if you can't, but again, that is a factor that you should think about. The way I would recommend using UWorld is I actually used it like via tutor mode. So I did not actually go through like a tutor and timed. So I did not you know, make it a test kind of mode, because what happens with a like you know, an exam or a test mode kind of thing is you go through 40 questions like in one instance, and then you go throughout the answers. But the problem with UWorld in Step 2 CK is the answers, the question stems are so big that, like, let's say you finish 40 questions, then you have to reread the question stem of every single question to understand the question again, and like to understand the answer again, so that you have a context, right? So you have to read the question stem. So that takes a lot of time. I would rather, like, you know, go on tutor mode and just solve one question and then see the answer, solve the other question and see the answer, then, like, you know, and keep on going like that in a sequential manner. So that saves a lot of time, because you don't have to reread question stems, and like once you solve a question, you already have that answer, so you have that context and understanding. At the same time, you're just like learning the answer. So I think that is what I would do, is I would do it on tutor mode, timed mode, because, like, you know, what happens in step 2 is you don't have a lot of time, and every single question stem is very, very big, and I feel like, you know, very like big and complex a lot of the times. So you have to train yourself to read faster. You have to train yourself to like skim through questions to look for the important information. You have to like make sure that happens from the first day. So I would 100% recommend just go for like the timed option. Do not go untimed, because step 2 is like so much reading, and you have to learn the art of skimming, the art of speed reading. I actually like have a course on it. It's called high intensity learning, where I teach you like something called as spacing and indentation to read 2 to 3 times faster, like without losing any comprehension, and it's free. You can check it out on my channel. Then like other things regarding UWorld is, do not care about the percentage. It's okay wherever you start, but try to improve that percentage. If it doesn't improve, that's also fine. But again, having that 10% effort into, like, you know, analyzing what went right, what went wrong, I think that is incredibly useful. So if you're doing 40 questions per day, you'll be kind of doing about 1,200 questions in a month, which would be like about, like, let's say 3 months, so 3,600 questions. So I think that is how long UWorld is. So 3 months you should keep for UWorld. So the first week would be kind of you're scoping throughout the subject, and then the next 3 to be UWorld. Along with UWorld, I would recommend, you know, marking any questions that you think were, like, you know, you still are not comfortable with, and keep marking questions like that you got wrong. So like I would not recommend you to like repeat UWorld again, which a lot of people do. I would rather keep a notebook with me. Like I would rather mark a lot, like whatever I got wrong, and mark like questions I'm uncomfortable with, while also keeping a notebook where I'm making, like I actually have my own notebook where there's like 300 pages of like probably the stuff I don't know, did not know anything about at that time. So like you are actually saving yourself a lot of time, because this is just like a mistake notebook or stuff like where you don't know that data, so that you can look over the data and you don't have to waste your time doing another pass. Because a lot of people, what they do is they already know the question and answer, they repeat the same thing, and that wastes a lot of time. I would rather just take the data from take all the data that you don't know from UWorld, put it in a notebook, all your mistakes, all the stuff you're uncomfortable with, and like do not include anything that you're comfortable with, like that you already know, and just use that for revision. So that was my revision notebook. It was like 300-400 pages long, so you can also make your own. Moving on, what book should you use for Step 2 CK? I would say Amber's library. There are like other books such as First Aid for the Step 2 CK. Then there's like some First Aid for the Step 2 CK, and then there's Step 2 Secrets, and then there's another one. I would not recommend any of these books because all of these fail to cover the vastness of what is Step 2, and like there are a lot of things that get updated in Step 2 because it's based on updated guidelines. So these books aren't updated as fast as Step 2, so you might get some like things wrong, some like questions wrong because of these books, and you might also get confused like compared to UWorld, because UWorld is very updated. So I would rather not touch any of these books. I would like rather go with something called as Amber's library. So Amber's is a question bank, we already know that, but it also has a very useful function called the Amber's library. And Amber's library is like, let's say you do a question from UWorld and you kind of like are like not sure about the explanation, or maybe you feel like you want to know more, like spina bifida versus chordae equina syndrome versus conus medullaris syndrome. You would see that in UWorld there's not much of an explanation for that, but if you want more of an explanation on how to differentiate these syndromes, you can just go to Amber's library and just search for them, and you'll also get tables to compare them and all of that. So Amber's library is very up to date because it is based on up to dated articles. You can also skim through a lot of things by pressing this thing called the high yield button, which will take out any fluff that you really don't need and just focus on Step 2 CK relevant content. And thirdly, it is very fast. Just like there's a search function, you can search any concept, anything you want, and it will show up. And there's like tons of great images, there are functions such as like where you can look at x-rays, and you can press a button and it'll show you the pathology, and you press that button again and it will go away. So it helps you like look at certain lung lesions or other lesions, and it's incredibly helpful. There's also histology pictures. So I absolutely I absolutely like fall in love with the Amber's library. So I would highly vouch for that. After any UWorld like concept that you feel unsure about, use the Amber's library with it, and I think that's more than enough. So what do you use? Like in addition to that, Divine Intervention podcast is highly useful. I've made a video on this, like how I scored 271 on the Step 2 CK. So you can go ahead and watch that. And in that I outline all the high yield podcasts from the Divine Intervention podcast that you guys can watch. It is very useful because Divine, who is I think right now in radiology residency, he adds a lot of knowledge to your UWorld knowledge, and that is very high yield, and UWorld doesn't cover it. So I think that was very helpful. And there are like a lot of podcasts which help you in revision of UWorld. So just turning that like podcast on, whenever I was working out or in the gym or maybe cycling. So that was incredibly helpful in revising Step 2 CK content as well as adding to my UWorld knowledge. After Divine Intervention podcast, what are the other things I would vouch for? I think CMS forms are incredibly handy and useful. So CMS stands for Clinical Mastery Shelf, and these are by the NBME themselves. So the latest ones are CMS forms 5 and 6. Previously we had CMS forms 1, 2, 3 and 4, but these are very outdated and I would not recommend you use them, because when I try to work with CMS 1 to 4 for every single subject, there are 6 subjects in Step 2 CK that we cover. So every subject has their CMS forms. So when I try to go with the 1 to 4 of the CMS forms, it was not helpful at all because they're very outdated. 5 to 6 were very updated, and I think they are one of the best representations of how the current Step 2 CK is, and it was like really helpful to go into the NBME's like thinking and understanding like how the NBME thinks. So I think like incredibly useful. You can start using CMS forms as soon as let's say 1 month or 2 months of UWorld are over. I think 1 month of UWorld is over. I think that's a safe time. So if 1 month of UWorld is over, start your CMS forms every every Sunday or like any day you have a holiday, and go through like the both of the CMS forms per subject. So there are 6 subjects and there are 2 CMS forms per subject, CMS forms 5 and 6. So in total there are 12 CMS forms. So like, you know, you can like, and every CMS form has like 50 questions. So I think 100 questions, you can like 2 forms, which is 100 questions, you can easily go through. So every single subject you can cover on, let's say, a weekend, when like you have a holiday, just one day, just go through it. Any explanation that you want, NBME will provide with it. I think CMS forms 5 and 6, like you get that. You can also get them from their website. The reason I would really like, you know, you need to think about CMS forms and need to go through them is because there is a discourse between UWorld and CMS, or UWorld and NBME's thinking. So when I like went to give my Step 2 CK and I went through the exam, what I discovered truly is like the real exam doesn't trick you as much, while UWorld tricks you a lot, right? And that is a problematic issue, because when you're going through UWorld, you're starting to like overthink your answer choices, and you're like, it makes you overthink everything, which is a very bad thing, because sometimes the simplest answer, or the Occam's razor, if you're familiar with that concept, is the answer a lot of the times in the real exam, right? And that is how NBME thinks. Like they have a very simplistic approach to asking questions, and like most of the times the answer is very simplistic, but UWorld doesn't train you like that. It makes you overthink, which can get you a lot of questions wrong. So very, very helpful to go throughout the CMS forms by NBME, so that you have a look at that. And certain concepts like are not similar with, like, you know, the answers to certain questions are not the same. For example, if somebody has spinal trauma, UWorld says CD scan, but the like NBME says no, go for the X-ray. And even Divine talks about it if you go throughout his podcast. So that I think is a must. So do CMS forms. So after you're done with CMS forms, there comes the NBMEs. So NBMEs are basically the test assessments are there to see like how well, like, you know, you will perform on your exam, and they'll give you a 3-digit score. So I think NBME 9, 10, 11, which are the most updated, you should just do them. 6, 7, 8 are very outdated, and it's okay and it's safe to skip them, and don't worry like if you skip them. So 9, 10, 11 would be one of, like, again, very representative of the main test. Free 120 by the NBME is also really great, and I think was one of the most representative like of the whole exam. I think free 120 was right there. It is tough, so don't get scared, but that is how the exam is, tough but simplistic. On you know, when should you start your NBMEs? I feel like the last month is completely okay. Like, you know, in those 3 months of prep, the last month is when you should start. And in the last month, the way to go through the NBMEs is every Saturday do your like first NBME, so NBME 9, then Sunday do the free 120, and then let's say the next Saturday do your NBME 10, and then, like, you know, you can probably mix the UWSA, like add it on the Sunday, and the last like, you know, in the 3rd week you could do your NBME 11 and UWSA 2. I think that about sums it up, if that made any sense, right? So you can mix your free 120 with NBMEs and UWSs and do it on weekends. You can like even alternate, it depends upon your schedule. How, like, the last week you should keep for revision, and the way I would advise you to revise is, like, you know, make your own notes, which I told you, like make this mistake notebook, or like, and add to it all the mistakes that you make, all the concepts in UWorld that you weren't sure about, and like, you know, that should be, that is the only thing that should be there, nothing that you already know. I would never recommend that, right? Because you're gonna waste time. So last week should be just focused upon your mistakes, going through, like, you know, whatever is confusing to you and whatever like was out of your sphere of knowledge, and just go through that in the last week. And I think that's about it. So if you want to take another week, it's okay. You can go like take 2 weeks and go through them, and even look at your incorrects in UWorld if you have the time. I did not have the time for that because I just had a week. So in that last week, I just went through my mistake notebook where I went through all the concepts. that I was not familiar with. So anyways guys, thank you for giving me your time and all the best.